Is your baby refusing the bottle? I'm Dr. Mona, a board-certified pediatrician, IBCLC, and mom. And today we're talking about 7 tips to help you with bottle refusal. Thank you to Philips Avent for sponsoring this video. I'm excited to discuss bottle refusal, which can be so stressful for parents, but it doesn't have to be. Philips Avent and I want to remind you to share the care, which means sharing the load of taking care of your baby with your village, especially in that 4th trimester. For me, this meant utilizing the help of my husband and parents to bottle feed pumped milk using the Philips Avent Anti-Colic Bottle with AirFree Vent, so I could attend therapy sessions and physical therapy sessions as I recovered physically and emotionally after postpartum complications. Before we get into the tips, let's start with the basic question. Why does bottle refusal happen? This is important to know because the tips address these reasons. In no particular order, a baby may refuse a bottle because he or she may be used to nursing and the bottle feels different to them and thus they reject it. Even young babies get comfortable with what they know, so change can be hard. A parent sometimes waits a long time to introduce the bottle and their baby loses the primitive suck reflex, so learning this is a new skill. Oral issues such as low oral tone, lack of oral stimulation, or tongue ties or oral ties can lead to difficulty feeding at the bottle and breast. Stress and pressure from the parent. Yes, this is real. Forcing a bottle can lead to a feeding aversion, and an uncomfortable feeding position can attribute to this as well. Reflux. If a baby is uncomfortable with acid reflux, they may refuse feeding sessions at the bottle, creating a feeding aversion. These can all be very stress-inducing, and I want to help that, so let's discuss my top tips. And make sure to stick around until the end to know when you need to seek help for bottle refusal. Tip 1, don't wait too long to introduce a bottle. If you know you have plans of introducing a bottle at some point, whether it's to go back to work or you want others to share the care and help with feeding express breast milk or formula, it is ideal to introduce the bottle before 6 weeks. Babies lose their primitive suck reflex by 10 weeks, and introducing a bottle before 6 weeks can mean more success. A primitive reflex is an innate involuntary response that newborns have. And the suck reflex is simple. You place a nipple in a baby's mouth and they suck for nutrition or comfort. This newborn reflex isn't voluntary, but around 10 weeks, it does become a voluntary reflex. So bottle refusal can be more common. I highly recommend even considering introducing the bottle around 3 to 4 weeks. Formula-fed babies, of course, will get introduced to the bottle earlier, but once nursing is established and you need or want to introduce bottle feeding, introducing it earlier can help. Introducing the bottle allows you to share the care of baby. Sharing the care is important as it will help you get time back for yourself, whether you have a career or even to simply provide peace of mind if you need to run an errand. Or maybe you have low milk supply or want to balance nursing and others' help allows you to have more time for self-care as well. There are many reasons why bottle introduction may happen, and doing so earlier may be better for you and your baby. Tip 2, be consistent. Practice daily and relax your body. If you find your baby is showing signs of refusing, it's important to continue to offer the bottle. You can either bottle feed after every nursing session or choose one or a few feeds that will be bottle fed exclusively. It is key to stay relaxed and calm with these offerings without expectation. One of the leading causes of bottle refusal is parental pressure. Forcing a bottle in your baby's mouth when they are fighting you and crying can lead to more refusal of feeding. And I speak from personal experience. My daughter would take very little amounts of pumped breast milk. Sometimes I would force her to finish the bottle, which I knew was the cardinal mistake in feeding. But I had anxiety and would panic about her weight and not feeding enough, even though she was content. This, or forcing in general, led to a feeding aversion for her. So anytime she saw the bottle or would be put into a feeding position, she would cry. It took me playing some calming music or white noise, calming myself, and not forcing the bottle to reset this aversion. If she refused, I would say, okay, you're telling me not right now. We will try again later. This mantra helped calm us both. We reset the feeding experience to be more enjoyable for both of us. So remember to offer, practice, but remove the pressure. If they don't take the bottle, it's okay. You just try again later and try again later and try again later. Every time remembering not to force. Tickle their lip, allow them to open around it. Offering practice and consistency is the way to help them learn. Eventually, I got my daughter to take a bottle happily without the tears. Tip 3, consider timing of practice. Introducing a bottle when they're overly hungry and thus fussier may not lead to success. If they're used to getting it from the breast, try to introduce the bottle when they're not overly hungry or full. This may require you playing around with their schedule to find the sweet spot. Some parents sometimes do a dream feed for bottle refusal, which is feeding the baby when they're drowsy. This is an option for some feeds, but it's important to practice when they're awake and alert to avoid the habit of them only feeding when drowsy. Once the primitive reflex is gone, the only dream feed approach may backfire because they never get fully conscious to voluntarily practice at the bottle. Tip 4, find the right bottle, nipple flow, and position for feeding. Finding the right bottle can be helpful as well. Philips Avent has 2 popular bottles to choose from: Philips Avent Anti-Colic Bottle with AirFree Vent and Philips Avent Natural Bottle with Natural Response Nipple. Philips Avent Natural Bottle with Natural Response Nipple supports your baby's natural feeding rhythm, so it can be a great choice for breastfeeding moms. It has a soft, flexible breast-shaped nipple that allows for an easy transition between breast and bottle feeding. The design is such that the milk only flows when baby is actively drinking, similar to breastfeeding. Philips Avent also makes the Philips Avent Anti-Colic Bottle with AirFree Vent, which has a nipple shape for a secure latch and an AirFree Vent that is designed to pull air away from the nipple, keeping it full of milk to reduce colic, gas, and spit up. The bottle design helps make sure baby swallows less air, which can cause discomfort. If your baby is struggling with bottle refusal, try allowing them to suck on the nipple alone without the bottle attached, like how they would suck on a pacifier. You can even warm the nipple under some hot water so it's closer to how a breast would feel in terms of temperature, and add some milk to the tip of the nipple as well. In terms of nipple flow and position for feeding, this can really impact bottle refusal. Going back to tip 2, your comfort and stress really can impact the feeding experience. So find a position that is also comfortable for you. Side lying and pace feeding are great options. Nipple flow can also impact bottle refusal if baby is getting milk too quickly or too slowly. You can find tips for finding the right nipple size for your baby in my bottle feeding basics video here, including how to feed via pace feeding or side lying techniques. Tip 5, share the care. Oftentimes bottle refusal is due to the baby being used to getting fed at the breast. If you are going back to work and nursing at work isn't an option, you will need to share the care and have someone help bottle feed your baby. Baby may be more likely to take a bottle from someone else than mom at the beginning. When practicing, leave the house and make sure the person who is with your baby understands the tips mentioned above, especially about remaining calm in a peaceful space and not pressuring the feed. Have that caregiver at home feed in different locations around the house or in different positions. You can also have the other caregiver wear something that smells like you to help baby. But truly, patience, consistent offering, staying calm, and not pressuring is key. Tip 6, think about your milk quality or temperature. As an IBCLC, one common issue I see in bottle refusal is the milk quality. Consider warming the milk up to room temperature if needed. If it's formula, use room temperature sterile water. If it's frozen breast milk, thaw it in a mug or hot water or use a bottle warmer, and be sure to check the temperature on your wrist before offering it to baby. Some babies do not care about the temperature of milk, but some may like it more room temp or warm, like what comes out of the breast. You could use products like the Philips Avent Premium Fast Bottle Warmer to help with this as well. Another potential issue is high lipase. High lipase is something you can't prevent, but does impact frozen breast milk in some women. How you can test if you have high lipase is smell how freshly pumped milk smells, and then smelling thawed breast milk. If you notice a very distinct soapy or metallic smell in the thawed breast milk, you may have high lipase. La Leche has a great resource attached here about high lipase milk. Tip 7, time. I asked my community at Pete's Dog Talk on what helped them with bottle refusal the most, and the most common answer was time. The tips I mentioned above were popular as well, but time is key. Consistency, offering, and age finally helped. For some babies, time passes and they finally get to the age where they take a straw cup or open cup, which I have seen as young as 4 months. It's something to consider if all the previous tips didn't work. Bottle refusal can be stressful. I've been there personally and have guided many families in my office. It's really important to also know when to seek help. Seeking help for bottle refusal early is always a good idea. You can ask your pediatrician, an IBCLC, or breastfeeding specialist for tips. This person should be knowledgeable about bottle feeding as well and not shame you for wanting to bottle feed. Sometimes a baby may need to see a newborn feeding therapist, which in the United States can be found through an early intervention assessment or resources through your pediatrician. Here are some other signs to seek help if your baby is refusing to bottle feed. A newborn and infant feeding specialist may be helpful in these situations to maximize the feeding experience. Because pressure and parental stress can lead to more refusal, it's important to find balanced and motivational support that helps you through this phase that will get better. Remember that being patient, consistent, and not pressuring is key. Many times our stress and fear of bottle refusal is a vicious cycle that leads to more stress around feeding times and more refusal. Get your bottle, have faith in your baby, and patience with yourself, and focus on creating a positive feeding experience versus a stressful one. Have questions? Comment below. And if you like this video, make sure to hit that like button and subscribe button, and see you all next time for another video here on Peds Doc Talk TV. Stay well.